All right, so I think we're ready to start. This presentation is Demystifying Medicare and Social Security. I thought of that name because when it does come to these two subjects, it is quite a mystery between all the mail that you're going to get once you get into your 60s and all the conflicting information you might get from friends and family and TV advertisements from stars from old TV shows. And I wanted to try to demystify it by summarizing everything that I've learned over the years, and I continue to learn. I just went to a Social Security presentation 2 weeks ago, and I incorporated some of that new information into this. So it is an ever-evolving, changing system. So if there's something you hear where you think, well, that's not what I remembered hearing at my old job or 4 years ago, it could be that it's changed. So I will try to get you up to date and ready to go. So why is it so mystifying? Or so mystifying. What is it about when you get to, this certain age that things start to get a little crazy? Well, it starts at age 59 and a half. So that's when you can actually get to your IRAs and 401ks and withdraw money penalty free. So that's sort of like the kickoff of you've now graduated into pre-retirement age. Then you turn 60. And at 60, you actually can take reduced widow's benefits from Social Security. Then at 62, that's your earliest age where you can take your own Social Security benefit. Then at 65, now you're applying for Medicare, Part A, Part B, Part D, you might need a supplement. Then you turn 66, or maybe it's not until 67 that is you reach your FRA, or your full Social Security benefit. Now you need to know that between the ages of 62 and your FRA, you're going to get 8% less each year you apply early. So at 62, that's considered early Social Security, but every year you wait, it's a little bit more, but the FRA is a big key to know for you. Now, if you wait until after your FRA and until you're age 70, then you can get your maximum Social Security benefit. And also, you can apply for Medicare anywhere between age 65, 70, and even sometimes beyond if you're still working. So don't feel bad if this feels a little confusing to you, because all of this happens in a span of 10 and a half years that you have to figure out, and it can get quite confusing. Oh, sorry, 72. Then you have to take your required minimum distributions from IRAs, 401ks, other retirement accounts like that. So now we've added another 2 years where you still have something you need to worry about. Okay, we're going to start with Social Security. And we are focusing on retirement benefits. Social Security does have a system designed to help when there is disability or if there is a death and there are children in the home. But we're going to focus just on really what applies to those of us that are here on the call today. And so we're going to do retirement benefits. And I have on here the website address, www.ssa.gov. You need to go to this website if you've never gone before and activate a login for this account. It sounds very simple. Okay, username, password, no big deal. It's a little harder than that. You actually need to answer questions, and they generate these security questions from your credit report. So it may ask you, you took out a loan for a Honda Accord in 1995. What color was that car? And I know it can be hard. The first time I tried to answer the questions, I flunked, and they wouldn't let me create a username and password. I had to wait 24 hours and then try again. So it's not a big deal if you flunk. You just have to try again. But it is good that they have this system so tight where it is hard to create that account. But unfortunately, fraudsters still have been able to do it. And employees from the Social Security Administration, every presentation I go to, they say, please, please, please ask your clients to get on there and create their account because it cuts down on fraud if you've legitimately logged in. Plus, it's full of great information. We used to get those huge newsletter things with the summary of our benefits and all the years we've worked and our pay. They don't mail those out much at all anymore. So now they want to go digital and have everyone get them online. Some people say, well, isn't Social Security broke? Why should I even bother with looking at my benefits and dealing with this? So employers and employees each pay 6.2% tax on wages up to a max of $137,700. What's interesting about this is that's a pretty low wage now. This hasn't really kept up with time and benefits increasing. So one way that the Social Security system could be helped is that they could raise that ceiling. I mean, even if they just raise it to 150,000, then that tax could still be taken to add to the system. Now, Social Security is fully funded, is the term they use, until around 2035, which is about when I'm supposed to draw Social Security. But starting next year, what is spooky and what you've probably heard in the news is that Social Security will begin drawing down their trust fund because Social Security is a Ponzi scheme. So there's not as much money coming in with the 6.2% taxes as there is going out to all the baby boomers that are retiring or have already retired. But even if the Social Security trust fund runs out of money, the system itself could still pay 79% of promised benefits. Now, it would be awful to have your benefits reduced by 21%. And I've heard, some pundits say, no, it would just be for the people that are signing on later. So those of you that are already drawing would probably stay at the same amount. But fingers crossed, Congress will keep working on this and repair this system that is breaking. Okay, so when you use your My Social Security, this is after you've logged online, you can see whether you do qualify for benefits. And you need 40 credits or 10 years of work to get a retirement benefit. And in today's terms, one credit equals $1,410, or 4 credits in a year is that you've worked and earned over $5,640. And I think that applies to most of us that are on the call. Now, having those 40 credits also qualifies you for free Medicare Part A. A is an apple, which is the hospital benefit. And a lot of people ask me, well, how do they calculate, if you just need these 10 years, how do they calculate your benefit? Well, it's actually calculated on the average of your highest 35 years of working. They also inflate, though, early years. So when you were 20 years old, if you only earned $15,000, that has been brought up to today's dollars, which means it could be one of your highest years. It's a very complex system. You can go and play with calculators online if you want, especially once you sign up and the system can input your data. Some people wonder, okay, what if I quit work at age 63 but don't draw until 66? You're probably okay because you still have that highest average 35 years, but these calculators might be something you'd want to look at. All right, benefit options. Okay, here we go. Your reduced benefits start as early as age 62. Now, your full retirement age, or FRA, is going to be either 66 and I think 2 months, 4 months, 6 months, 8 months, 10 months, or 67. And there's a whole chart I could have included about that. But hopefully everyone already knows what their FRA is. If you don't, you will find out as soon as you create your account. Then the maximum age that you apply for Social Security is 70. It never gets any bigger than that. So do not, by any means, wait past age 70. That's the max you'll ever get, so you want to draw at age 70. Now, I mentioned that between ages 62 and 67, and I'll just use that as, let's say that's your FRA, because that's my FRA. Every year you take it early, and that's the term they use. It's early retirement. If you draw your Social Security before 66 or 67, you're gonna have a reduction of 8% per year of what that value is. Now, those of you that have looked at your statements, it will tell you what you will get per month at age 62, 66 to 67, and 70. There's a common misconception, though, that those are the only ages that you can take your Social Security benefit, and that's not true. Once you turn 62, you can take it any month between that age and age 70. And every month you wait to take it, it gets a little bit bigger, a little bit bigger, a little bit bigger. But it averages 8% per year when you wait. And so the good thing is, if you wait past your FRA, it gets higher by 8% for every year you wait. Okay, so how different is the amount? Again, you'll see yours on your statement, but this chart, you can look at your year of birth to figure out. So like if you were born between 1955 and 1959, you get to have the funny 66 and so many months. And then if you were to take it at 62, you'd only get 70.8% of your benefit. And if you wait, though, until you're age 70, you get 130%. And I did an example born in 1970, because that's when I was born. So if at full retirement age, I were to get $2,000 a month, if I take it at 62, I'd only get $1,400 a month. But if I wait until age 70, I get $2,480 a month. Okay, I'm not seeing, it's interesting. I'm not seeing the chat. I'm not sure why, and maybe it's because I'm sharing my screen. But I'm going to go a few more slides, and then I might go out and, I'm seeing a more. So there is a chat. Thank you. Okay, here it is. Thanks, Terry. Okay, what if I'm still working? Well, you need to stop and think about that before you draw your Social Security. There are annual earnings limits before you reach your full retirement age, which means, so if you're still working full time, then you cannot earn more than $18,240 and then also draw your Social Security. So there are some people that they might get laid off or they retire early and they're not earning that much income. And so then it is fine for you to go ahead and start your Social Security and get that reduced benefit. Now, the year you turn your FRA age, and it's interesting because that starts in January. So like my birthday is January 25th. So my year of FRA is only 25 days. So they actually do use that calendar year, but you're allowed to earn $48,600 in that year. And work means gross wages or net self-employment. Work does not mean any kind of money from your investments, from your pensions, your 401ks, your IRAs, annuities, interest income, dividends, cap gains, unemployment, home sale, or your spouse's earnings. So all this other money that might come in is fine, and they don't look at it. It's only if you actually do work. And they also look at it month to month. So the Social Security system knows if you retire mid-year, And it's fine. If you would have earned $50,000 from January to June, and then you retire in July, they realize that. And they'll just look from July to the rest of the year to make sure you don't go over the earnings limits. And then once you reach your FRA at 66 to 67, you can work and earn all the money you want. You can earn $1 million, and that's okay. And you can have your W-2 income and your Social Security. Okay. Public pensions and Social Security. This can get interesting. There's a windfall elimination provision, and that's if you do have your 40 credits where you're going to get a Social Security check, but you're also getting a pension from a non-FICA system. So this might be old civil service, public systems, but like here in Ohio, it's OPERS, there's STRS, SERS, police and fire. And if you have one of these types of pensions, and let's say you were a school teacher for 20 years, but before that you worked at a company job for 20 years, you are going to need to check some calculators or work with a planner, a financial advisor like me, and figure out if there's going to be an offset. So when you go to My Social Security and use your retirement estimator, it's not going to figure out that windfall elimination provision. You're going to have to use a separate calculator to look at that. And it often doesn't mean, it's going to hurt you that much. It's just they have a max of what you can get with the two combined. Okay, how about spousal benefits? I get questions about this a lot. And the maximum spousal benefit that you can get is 50% of the worker's unreduced benefit. And I know that sounds confusing, but basically it's when your spouse reaches their FRA, let's say 67, and whatever they're going to get, you divide it in half, and that's then the most you can get of their benefit. Both of you needed to have worked in Social Security covered employment. And actually, no, that's not true. If one spouse never worked, I think they can still qualify. But in my example, I say both of you have worked and you both have a benefit. But if the spouse is paid the higher benefit amount, if 50% of the spouses is greater than their own benefit. So I put a little example here to the side because this does get confusing, because when you sign up for Social Security, you need to let them know if you're married, and they will look and see what's better for you. But even when the spousal benefit's higher, you're still applying for your own benefit first. So that's why it shows here with Pat, on their own, Pat gets $1,200 a month. But Pat and Jean are married, and Jean's benefit is $3,000. So half of $3,000 is $1,500. So what they do is they add an additional $300 because of Jean to Pat's benefit, and Pat will get $1,500. Hopefully that's pretty clear. I did put a little note down at the bottom that you cannot file for spousal until your current spouse files. So that does not apply for divorced spouses, but if you are currently married, you need to coordinate when you are both going to file so that you can maximize your benefit. All right, what about if you're divorced? So you can still receive benefit on your ex-spouse's record, even if that ex-spouse has remarried. You, however, need to be unmarried for you to start drawing this benefit. Both you and your ex are 62 or older, and you were married for at least 10 years. Another thing I didn't put in here is I believe you can't start the benefit until you've been divorced a year and a half, I believe. Now, as with a current spouse, you are entitled to the higher benefit amount of your own or 50% of the ex-spouse. But what's nice is that ex-spouse does not have to have applied for Social Security yet, because they realize you can't coordinate a plan with an ex-spouse. And so, but they do need to be of that age of when they can file. And if they're only 62, their benefit is a lot less than when they are 66, 67. And as a note, spouses, ex-spouses benefits have no effect on the worker or the other spouse. So never feel guilty about asking about your ex-spouse's benefit, because it doesn't lower anybody else's. And this might be putting a strain on the system. I mean, you can think if someone was married to 3 different people for 10 years each, there could be 3 people that are drawing on one person's record as an ex-spouse. But that's the way the system works, so you might as well work within the system. If you are divorced and you are going to file for your Social Security benefits, you do need to point out to them, I was married for 10 years, this was their name, and I would like you to look and see what their record is. It helps if you know their date of birth and Social Security number, but the Social Security Administration should have access to those records. But there might be additional paperwork and hoops that you're going to have to go through. So just be prepared when you go to file for it. You may need marriage certificates and divorce certificates to prove the marriage. Okay, widow's benefit. So now it is that a spouse has passed away. And that this is either a current spouse or an ex-spouse has passed away. So with widow's benefits are 100% of what the worker was receiving at death or would have received at their full retirement age. You can get a widow's benefit as early as age 60, but it is going to be reduced. It's only going to be 71.5% of what that full amount would be. And I say this at the bottom, but it's worth saying a couple of times. Your earnings limits still apply for widow's benefits. So you can't continue to work and earn $60,000 and get widow's benefits, because they'll reduce it because of your work to the point where it's not valid to take it. Okay, so again, divorced spouses may qualify, and you can actually get remarried and still get a spousal benefit if your marriage was after you turned age 60. So, and that's kind of, it makes sense. I mean, it's almost like you need to wait until you're 60 of when you can get a widow's benefit and see, you know, if you're going to get something. But I mean, even if you don't, you marry at age 61, and then that ex-spouse dies 10 years later, you still might be able to get a widow's benefit that's even larger than the one you're taking right now. So you get to the higher benefit amount, whether it's your own record or the deceased. And, but I said, however, unlike a living spouse, you can switch benefits. So you start, in this scenario, you start as a widower or a widow, and you begin to draw the benefits at age 60. And you don't work much, but you're drawing these benefits. Your own record in the background is getting bigger and bigger and bigger and bigger. So then at age 70, it might be that you could switch, and you call Social Security and say, well, now I don't want my ex's, my deceased ex's benefits anymore. Now I want my own benefit, and they'll raise it up to that amount. Okay, I am going to check the chat real quick. Let's see. So here's a question. I've heard that if you take it early, it works out the same because you get it for, oops, sorry, I just skipped so you get it for a longer time. Is this worth considering? All right, so I'm going to stop sharing here for a second because I have messed up my screen. And I will say, I apologize for this. What's bad is that my buttons aren't working for me to go back in my presentation. So I'm going to have to change my view here and stop my presentation. But I will go ahead and tell you that it's hard to know exactly when to start. And I think that it's worth talking with someone about when to start your benefits, because sometimes it can work out good to go early. But I will say in almost all scenarios that I've seen is that if you live past age 83, 84, then it's actually better to wait and take your benefit at age 70. But that's to get the maximum amount of money you can from the Social Security system. That might not be a concern for you. You might rather just time it for when you retire, because by you taking Social Security benefits right when you retire, that's going to keep you from eating into your savings and having to take money out of the market in order to live on. So just more like anecdotally or budget-wise, I've found that a lot of people prefer to just go ahead and take it out when they need the income, and versus trying to play the system so that they get the absolute maximum amount. But I also say it's different for every person. So that's why I say you should always talk it through, work through your budget, work through when you want to retire, and make the decision that way. I did have here a widow's benefit example that I wanted to show. So now we have a different couple, Mac and Terry. Mac's benefit before death was $2,300. Terry's was $1,400. But when Mac died, Terry's benefit then changes from $1,400 to $2,300. So they get the higher amount. But I did make note that the household used to receive $2,300 plus $1,400. So it was $3,700 total that was coming into the household to cover expenses. But now that Terry's alone, they'll have to live on only $2,300. But at least there's the higher amount. But it's another common misconception that when your spouse dies, you get to keep your own Social Security benefit, plus you get theirs. And unfortunately, you don't. Okay, so how and when to apply? You can apply for Social Security benefits 4 months in advance. So if you're planning your retirement and you're ready to get the ball rolling, you can start doing it 4 months before you want to get your benefit. You can, most of the times you can apply online. Sometimes you can't for widow's benefits. I believe you can't. Or by phone. And yes, you have to call an 800 number. Yes, it's going to be a long wait. It's just the nature of the beast right now. And because of COVID, there are no in-person meetings available. They have shut down all the offices. You can track your application status through the My Social Security account that I mentioned online. And the application lets you tell them when you want your benefit to start. Now, normally the application is processed in 4 weeks, but it can take longer because of COVID, but also because additional evidence is requested. And that could be, like I said, marriage certificates, divorce certificates. God forbid they need even a birth certificate. I've never seen that happen. But there's also some evidence that they might need for other situations. I'll just leave it at that. Now, benefits are paid the following month. So if you elect for your benefits to start in January of 2021, you're actually not going to get your first deposit until February of 2021. So keep that in mind when you're planning your budget for when retirement starts. Your payment's usually on the second, third, or fourth Wednesday of the month, depending on your date of birth. There's a link where you can actually look up when yours is going to come. And then you do receive a 1099 annually for your Social Security benefits. Some people will say, oh no, your Social Security isn't taxed. Well, for some people it's not, because their income is so low that they don't even reach that threshold of needing to file taxes. But there are a lot of us where, yes, your Social Security is definitely going to get taxed. For some people, only 50% of the amount applies to tax. For some of us, it's 85% of it applies to tax. Now, I'm not saying there's a tax of 85%. I'm just saying, if you get $2,000 a month, 85% of that does get added to your taxable income. Now, to have taxes withheld from your Social Security check, you actually have to go out and voluntarily fill out a W-4V. And it's a form that I have. You can also find it online. But this is what it looks like on the bottom. And so it's similar to when you took a job and you had to give them a choice of your withholding. And this is another common misconception. They think, oh, well, when I apply for Social Security, it'll ask me how much tax I want withheld. Nope. You have to go out and fill this form out and then either fax it or mail it to a local Social Security office. And an interesting thing to point out, number 6, if you see the lowest amount you can have withheld is 7%, and then the highest is 22%. Those are very odd amounts, but that's just the way it is with the form. So you're going to have to choose one of those. All right. How about some Medicare? We're going to roll on into that. So Medicare is at age 65. That's the magic year for Medicare. And you are automatically enrolled in Medicare if you're already taking Social Security. Now, you actually have to proactively go out and sign up for Medicare if you're not already drawing Social Security. And that's pretty common for a lot of people. And I wish they'd coordinate the ages, quite frankly, because Medicare is at 65, but your full retirement age isn't until 66 or 67. But I mean, if you retire at 65, you can sign up for everything all at once. Take note that I mentioned this retroactive 6 months. Have no idea why they do it, but they do it. So you actually have become a Medicare eligible person at 64 and a half if you sign up at 65. And you think, well, okay, whatever, no big deal. Well, it can be if you are contributing to an HSA account, if right now you have high deductible health insurance, because you are not allowed to add to an HSA when you're on Medicare. So plan ahead of your retirement and think ahead and like, okay, I'm going to retire, and maybe you're not going to retire until you're age 66. To be safe, though, stop your HSA contributions at 65 and a half. The penalties aren't horrible, but it's just a pain in the butt. And it can be a real pain to get those monies out of the HSA account as well. All right, initial enrollment, when you actually do need to go online and do this, if you're not drawing Social Security, is 3 months before your 65th birthday, and it ends 3 months after your birthday. Now, this is if you're not in a group work plan. So I don't want you to panic. If any of you are over the age 65 and you haven't done this yet, it probably means you're still working. So special enrollment, you can delay it after age 65 if you or a spouse is covered under a group health plan based on your current work. This is tricky. So this is what does not apply. Retiree health coverage. So some companies will continue to provide a health benefit even though you're no longer working for the company. That doesn't count. That can count for, say, like a Medicare supplement, but it cannot count for basic Medicare. You still need to sign up. COBRA doesn't count as a group health plan. And the Affordable Care Act doesn't count as a group health plan. So if you are on an ACA plan and you are about to turn 65, you are forced to switch to Medicare. But trust me, you'll probably get a better deal anyway, so it's a good thing. So you get no penalty if you enroll within 8 months after you or your spouse stop work. I don't really recommend waiting that long. I recommend having a plan on how you're going to sign up for Medicare and a supplement, well, quite frankly, for the day after you retire. But they do give you 8 months to get it all figured out. And you really need to, because the penalties are very high for not signing up. Some disabilities and end-stage renal failure also are eligible for Medicare. But again, I'm focusing more on retirees. Okay, Medicare Part A and employer insurance. So you're working. And I get this question a lot, so I wanted to put this slide in. And I know it's a lot of information here. So most traditional employer health insurance will have you enroll in Medicare Part A, which is the free part, and they'll use it as a secondary coverage. But I tell everyone to talk to your HR department or HR person or whoever it is that's in charge of your health insurance, because you really want to coordinate that and how that's going to work. And you have to use caution with some of these plans. And I'm actually not going to go through all this. I already mentioned the HSA contributions was 6 months, but it's something just to keep in mind. If you're turning 65, you're still working, and you wonder, should I go ahead and sign up for the free part? Again, talk to your HR person, and that's the best way to know. Okay, what are all the different Medicare parts? This does get very confusing. So here are the different Medicare parts that are associated with the government. I'll say it that way. So Medicare Part A is hospital insurance, and it covers when you go to the hospital, if you need care in a skilled nursing facility short term in order to get better. So this is like rehab. Covers hospice care and some home health care, but not permanent home health care. Medicare Part B is your medical insurance, the health insurance we're kind of used to. And it covers doctor's visits, outpatient care, medical tests, supplies, preventative services, things like that. But it only covers 80%. So they cover 80, your share is 20. Medicare Part D, as in drugs. So this is your prescription drug coverage. And it could also include some shots and vaccines. All right, how much do these parts cost? So again, Part A is free if you or your spouse worked 10 or more years in a job that paid Medicare taxes. And even if you never did work or never had a spouse that worked, you could still qualify, but you'd have to buy the Part A. Part B, the price just went up for 2021, so I decided to update the slides to the newest amount. Those of you that are already drawing Medicare, you're grandfathered in, and your price will not necessarily be this. But for people that sign up for Medicare in 2021, it's going to be $148.50 per month. This is typically deducted from your Social Security check. And I use check loosely because now it's an automatic draft, but it's deducted from your Social Security. If you're not drawing Social Security, though, and you want to sign up for Medicare, they're going to bill you quarterly, and that's going to be a big amount. So that's going to be, over $400 that you're going to have to pay quarterly for your Part B insurance. Now, that's just the minimum you have to pay. You might have to pay more than that if you have a higher income, and I have the chart for that coming up. Part D as in drug varies greatly, and it is something that people often shop around for every year. Well, I shouldn't say often, but you can shop around for it every year. And you can go to Medicare.gov and enter your prescriptions in to see which company has the best formulary that meets your needs. I also use an insurance person that she puts the formulary in and looks and sees what's best. And oftentimes you don't need to change your Part D plan unless your prescriptions change. But sometimes companies just get crazy and double their premiums, and you might want to look around. All right, Medicare IRMA, and that stands for Income Related Monthly Adjustment Amount. What this is what they came up with about four years ago, or so, 5 years ago now, probably, because Medicare was struggling as a system. And how are we going to keep it afloat with the premiums that we're getting right now? So an answer that was come up with is, if you're a higher income earner, you'll pay more in a premium. So these are all the tiers. If you file an individual tax return and you earn a total of $88,000 or less, this is when you're retired, then you'll pay the base $148.50 amount. I work with a lot of people on this when they retire, because what will count towards this individual tax return is also the withdrawals you're making from 401ks and IRAs. And those are under your control. So you may decide, oh, I'm only going to withdraw $1,000 a month from my IRA, which is going to be taxable income. And then if I need an extra $500 a month, I'll get that from my savings account or my Roth. And that way you can keep that income in this tier. So they give a higher amount if you file a joint tax return. But if you file a married and separate tax return, they really punish you. So I've had some clients in the years past that their CPAs liked for them to file separately because it saved them on state taxes. But once they got Medicare age, I had to warn them, if you go just to 177,000, it jumps all the way down. Actually, no, I'm sorry, 88,000. If you earn a penny over $88,000, then you pay $475 a month each for your Medicare. So it's pretty shocking. So I just had a question pop up, so I'm going to try to go to the chat without messing up things. Okay, gross or adjusted income? That's a great question, Terry. So I believe it's your modified adjusted gross income, or MAGI. And there is a certain formula for that. So that's your adjusted gross income with some items added back in, like your tax-free income from municipal bonds. There's something else that gets added back in, and it escapes me right now. But that is a good question. And it's something I can look up and help you with. Notice on the top, this says, if your yearly income in 2019 for what you would pay in 2021 was. So they're 2 years behind on looking at your income for these Medicare IRMA tiers, which, if it scares the bejeebers out of you, that's a good thing, because I want you to be aware of this. There's a way to fix it. What we do is, there is a form called the SSA44. I have this form that I can send you. It's also something you can get online. This is just a snippet from it. It's an 8-page document, but what it allows you to do is that if you stop working when you are in the year 2021, you can say, all right, I had work stoppage on this date, and so therefore in 2021 now my income will only be this much. And we have to estimate what your adjusted gross income would be. And there's a pretty good answer, Terry, to, is it adjusted gross income? Because there it uses AGI on this. So I'm guessing that they look at AGI then. Oh, look though, tax exempt interest. So they do add it back in to get your MAGI. So I was correct. All right, now what this will do then is it catches the Social Security system and the Medicare system up to what your true life is now, so that then you could go to that lowest level of the 148 per month. And I have done this form with a lot of people, and it works great. I mean, they accept it and go, okay, sure, you stopped working. But here's an interesting note, is that if you've worked past age 65 and you then sign up for Medicare, you are going to want to have a letter from your employer. And let's see, it might not say it on this little snippet of the form, but somewhere on the form it mentions they want proof of this. And it can be as simple as someone from HR just saying, to whom it may concern, Jane Doe stopped working on January 21st, 2021. And then that's something official that you would attach to this form. I like to mention it to people because once you leave work, you kind of lose contact with HR people, and they can be tough to track down. Okay, now, traditional Medicare versus Medicare Advantage plans. Any of you that are over the age of, let's say, 62, probably are beginning to get mail. And by the time you turn 64, you will get 6 inches of mail about Medicare plans, and it'll drive you crazy. And it drives a lot of people crazy because there are so many different companies out there. There's so many different plans. What should I do? Blah, blah, blah. I'm going to give you my 2 cents on what I have seen in the 15 years of being in this business and what I have seen work the best. But it is my opinion, so I'll let you know that right up front. So traditional Medicare is where you're paying Part A, Part A is free. You're paying for Part B. You also are getting a Part D, and then that's covering 80% of your costs. So to cover the 20% that's not covered by the government, then you buy a Medicare supplement, or sometimes it's called a Medigap policy. These plans have a higher premium, I'll be honest with you. They're going to be an additional, let's say, $130, $150 a month to cover that 20% gap. But there's no pre-existing conditions that they can deny you or increase your amount for. And it allows you to have a fixed cost, because these plans to me are like old-fashioned insurance. They cover practically everything. It does depend on which plan you choose. And yes, they use letters too, so it makes it very confusing. There are letters B through N. Plan G, as in George, is one that is becoming very popular, that I've had people sign up for. And here's an interesting little tidbit, is that no matter what company you go with, Anthem, Medical Mutual, Mutual of Omaha, any of these, if you're looking at a Plan G as in George, the coverage is exactly the same no matter what company is providing it. So then it's apples to apples to apples. And this makes it nice because they're going to be different prices. And you can be like, well, why? Why is it a different price? It's just that they're charging different prices. And you might feel better with one company versus another, but you don't need to worry that their Plan G covers less than another Plan G. Okay, different from Medicare, traditional Medicare, is Medicare Advantage plans. These are the ones that are advertised like crazy. And I even see them on television. These are private plans. So it's a deal they've made with the government that they're going to provide everything. So instead of money going to the government, it's going to these private plans. And to make them more enticing, they usually add in things like vision care, hearing, dental, and the premiums are really low. And so at first glance, you think, well, why wouldn't I want a Medicare Advantage plan? Costs less, has more benefits. Well, here's the trick. They're typically HMO or PPO plans that have a cost sharing factor. So yeah, you're paying a lower premium, but you're going to be paying out of pocket for copays, deductibles, things like that. And sometimes these deductibles can be really high, and that can be shocking. But some people that are 65 years old have never had a health problem, and they're very cost conscious, prefer to go this way. Now, later you can switch to traditional Medicare, but if you do want to switch, they can ask you health questions, and then that gets a little tricky. All right, so here's a chart I did to try to explain the costs. So you see on top, for monthly premiums, it could be that since you're paying $148.50 for Part B, $30 for Part D as in drug, and then let's say you paid $151.50 for a supplement, you're shelling out $330 a month. And but then with the Advantage plan, it could be very low premium. Now with coverage, with a supplement, any doctor that accepts Medicare patients will take you willingly. The Advantage plan, you're limited to a network. Out-of-pocket costs, low versus high. Additional coverage, there usually is none on these Medigap, but on the Advantage plan, I mentioned the vision and the hearing. But your possible annual cost, you see how there's a huge difference here, because there might be a little bit of, there's a small deductible and maybe some cost sharing with the supplement, but a max out of pocket might end up being $5,000. Where with an Advantage plan, if it's a high deductible of $15,000 and you had to just go in the hospital for one day, then you're going to be paying $15,000 out of pocket. It's a personal choice, and I do know someone that does Medicare coverage if you ever wanted to talk to someone, and she shops different plans to see what might work for you. But in my experience, the supplement plans have been great. Okay, Medicare Part D is in drug. Wanted to let you know this. This happened to someone I knew, that even while they were still employed and on a group health plan, they got a letter saying that the drug plan under the employer's health insurance didn't meet the qualifications of Medicare, which meant she actually had to sign up for Part D as in drug while she was still working. Now, that will only happen if you're on a very high deductible plan. If it's more of a traditional health insurance plan, you don't have to worry about it. But I like to mention it to people. I already mentioned how you can go online and enter your prescriptions and dosage and your preferred pharmacy, and you can do some shopping if you want. You can analyze it each year if your prescriptions change. Okay, retiring after age 65. So again, you have to keep your credible group coverage, including drug coverage, until you retire. And this is for employers that have 20 or more employees. COBRA and retiree health coverage often does not qualify. I'm repeating that again. You have the 8 months after you retire to sign up for Medicare and supplement a Part D plan, and penalties are high if you don't sign up. And really, you should have that Part B and your supplement lined up for the day after you retire. You need proof from your employer that you were on this group plan. So here again, you need a second letter now from HR before you leave the job. There's a downloadable form you can use, or I do believe they just accept a letter that if they say, to whom it may concern, Jane Doe was covered by a group health plan until her retirement date of January 21st, 2021. Okay, I got through it. I can't believe it. Of course, I don't know what time it is. For all I know, oh my goodness, 6:30. So we do still have some time. We want to stop share, and then I'm going to, how do I unmute everyone? I see where I can mute everyone, but it's hard for me to unmute. Oh, you guys can unmute.
We can do that.
Okay, great. Yeah, so this gives you the power to unmute if you want and to ask questions. So, anybody have any questions?
You did a great job.
Oh, thanks, Debbie. It's so much. I don't know if I demystified it.
You did a lot.
We better start talking tomorrow.
There is a lot, but yes, I love to hold anyone's hand through it.
I thought it was great, Carrie.
Oh,
I
thanks.
thought it was great, and you have helped me so much just demystify this and help me walk through what I need to do when. So you're a super resource.
And you're not prejudiced at all, right,
No,
Mom?
not at all.
Like a true mother.
Oh,
I know. I could have just been like, "Thanks, Paula," but everyone knows that Paula's mom.
Yeah, it really helped me too. I feel, it seems so complicated, but you made it look simple.
That's a big compliment.
mhm.
Yeah, and it still mystifies me that there's just so many things that you have to figure out, and at that time of your life too. It's like, really, can't you just make it a little smoother for people to transition into retirement?
That'd be too easy.
Yeah, could be. I wonder if I can turn videos on. It looks like I can ask you to start your video.
There.
Okay.
I can start my
Interesting.
own.
Yeah, I guess, yeah, if anyone does want to go on video, even though I felt like when I organized it this way that people might be grateful that I wasn't requiring video.
I don't know. I'm on it all day, although it's my day off, so I don't look that awesome. But
I think
You
you look
don't look at
great.
your appearance.
no, you did a great job, Carrie. I think what you showed was that you know your stuff. And
Oh,
so you're a great guide for not only can people trust you with their money, but they can trust you to guide them through this really confusing part of their lives.
Yeah, I agree.
yeah.
Well, she got me through it.
Oh.
Yeah.
I know, yeah, a lot of you have already gone through it, but
Yep.
and so I appreciate you suffering through listening to what all you had to go through.
We were looking for errors.
Yeah.
Yeah.
Oh, well,
Yeah,
and I'm kind of
okay.
glad that I got done in an hour. I had said it could go as late as 7 because I had so many slides. I thought, goodness,
You're okay.
yeah, it
Yeah.
worked out okay. All right. Well,
It is okay.
as always, I'm always here. Call, email, private Zoom account, or call, where we can talk over all this. And oh, thank you, Carol. Got a little thank you in the chat.
Yeah. You did
Oh,
great.
wonderful.
Great.
Hi,
Yes.
Carol. Haven't seen you in a long time.
Oh yeah. Yeah, you guys talked at my birthday party, or Mom and I's birthday party, about the golf. Yeah, I remember that now. All right.
Good
Well,
deal.
I'll let
Okay.
you guys go, but again, reach out if there's anything I
Thank
can ever
you.
help you with.
Yes.
Thank
I
you
want to. I
very
need to
much.
catch up with you.
Yes, I owe you a lunch or dinner someday when we can have lunch or dinner.
Yeah. Just reach out. We'll pick a time. We'll just have coffee over Zoom. We'll catch up.
All right.
All
Sounds
right.
great.
Okay.
Stay
Good night,
safe. Happy
everyone.
holidays.
Yeah, happy
Yeah.
holidays.
Thank you very much, Debbie.
Yeah.
You too.
See ya.
Bye.
Bye bye.
Bye.
Everybody.